just a quick review of the JHVW copper knee brace. So I think of this more as a sleeve than actually a brace, but nonetheless, it's made specifically for people that are having some kind of knee drop problems or some kind of knee pain. And the idea here is that you put on the sleeve and it supports the joint, supports the surrounding soft tissues around your knee, and does restrict your knee motion a little bit. So that way your knee has a chance, to rest, recover, and it doesn't get so overstressed as you're doing things. So a few points about this particular sleeve. It does have two straps on it, so it'll actually help keep the sleeve up a lot better. So if you had trouble with a knee sleeve slipping, shouldn't have that trouble with this one because it's got two straps. You get a little extra support there. The other thing I like about this is that it's made of nylon. So nylon actually is a very durable fabric, so I really expect this to be around a while. It'll really last you a while. So as opposed to made up of other things, like polyester or something like that. So nylon's a very durable material. So other things you can do for your knee besides a knee sleeve, I'll just use this as an example, bulletproof your knee, where I'm getting this stuff from. If you have any kind of problems with your knee, you basically make sure that you strengthen your quadriceps muscle. Quadriceps muscle is a group of 4 muscles that are on top of your leg here, and here's like your kneecap for reference. It's a key muscle that stabilizes your knee joint. So what they're finding is that when people have various knee problems, that they find problems with just the quadriceps muscle and not really any of the other muscles around the knee, but for some reason your quadricep muscles takes a big hit. So for instance, if they look at people that have like knee swelling and they test the muscles and everything, look at this. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So decreased strength means decreased stability in your knee, sets you up for other problems. Knee injuries in the quadriceps, if you've had anything like you fractured your lower leg bone, surgical opening of the knee joint, you've had knee surgery, researchers find you probably have some quadriceps weakness. Ligament tears or ligament problems in the quadriceps, the anterior cruciate ligament, also known as the ACL. When researchers look at people that rupture their ACL, look at this one. Research on strength of the quadricep muscles decreased by 25 to 30%. So that's really significant. Same thing with the PCL, the posterior cruciate ligament, medial collateral ligaments. Knee pain in the quadriceps. If you had chronic knee pain, they find people have decreased quadricep strength. Here's a good one: knee arthritis and quadriceps. A lot of research on knee arthritis and quad weakness. What they find is that people selectively have really weak quads when they have knee arthritis. Likewise, there are actually randomized controlled trials showing that if you take a group of people with knee arthritis and you just strengthen their quads, the knee pain starts to go away. And they also find that people that have the strongest quads have less progression of their knee arthritis. So actually can kind of interrupt the pathological process and keep it from getting worse. Patellofemoral pain syndrome. The list goes on and on. Definitely you have any knee problem, make sure you strengthen your quads. Fine-tune control over your knee, that's something else you can do. Here they're talking about your hip muscles. Sometimes the problem, you can have a knee pain. The problem is not at the knee, it's actually at the hip. So the classic example is iliotibial band syndrome. Take a group of people with iliotibial band syndrome and you test their hip muscles. They find they have unusually weak hip abductors. And that's a key muscle that keeps your pelvis level every time you take a step. Also brings your leg out to the side. And here again, randomized controlled trials showing that if you take a group of people with iliotibial band syndrome and you strengthen their hip abductors, that the iliotibial band syndrome goes away. So that's kind of interesting. Other things you can do: keep your knee flexible. We all know that your knee bends and straightens, and it needs to be flexible. But a lot of people don't know that your knee, it doesn't just bend and straighten, it actually rotates. About the last 10 to 15 degrees of extension, that's you straightening your knee out all the way, your knee actually laterally rotates out to the side. So here's a little test to make sure that you have that accessory motion, which you need for full knee functioning. Last thing, increased dynamic knee stability. Here they're talking about proprioception. So if I turn the lights out all of a sudden, you'd be able to tell me if your knee is bent or straight. And that's because you have little receptors in the joint, the soft tissues around the knee, constantly give your brain feedback as to where your knee is in space. And so what they're finding now, if they look at people with certain knee problems, people actually have decreased proprioception. So there's actually exercises you can do to get that back. So fully functioning knee isn't going to give you many problems. But hey, nothing's as quick as putting on the knee sleeve or a brace. Usually people get instant kind of relief. So it's a good one. Check it out.